Hi guys, I'm Dr. Parissis and welcome to another video. Today I'm in New York with Dr. Bloxham. Super lucky to be here, and I thought that we'd go through a case study of mine, a surgery that I was able to do for a young patient. Now the title of this video is about hairline beef-ups, and really we wanted to help you decide whether a hairline beef-up might be appropriate for you. So first of all, before we continue, I want to ask you, Dr. Bloxham, what exactly is a hairline beef-up?
Yeah, so a hairline beef-up, is probably kind of what it sounds like. It's basically a scenario where we're taking a patient who, has a pretty good hairline or has, some minor recession and sort of just wants to, improve it without dramatically changing anything. It's not really a hairline lowering, not so much of a hairline rebuild, a couple things that were done here that may be a little bit of that, but really it's sort of just, look, this is where the hairline is, I generally like the height, I generally like the shape, I just want it thicker. And you can see on this gentleman, that's really what was done. You can see he probably always had, we sort of follow these little baby hairs here, he always had this kind of natural, curve shape to it. It's just that over time he got the very, very classic recession in the corners and then this recession in the middle here that left him with these stronger tufts. So because we could still sort of see the silhouette, of where that hairline was, he said, I'm good with that. It doesn't need to be down here. I like it where it is here. Just beef it up. Just get that density back up there. So that's, in sort of a convoluted way, what I would kind of describe as a hairline beef up.
Yeah, exactly. So often with hairline beef-ups, we think of the area that is kind of void of hair, and that is the only area of the scalp that we actually put grafts into. But often we work a little bit further back as well.
Absolutely.
Obviously hair loss is progressive, and even if patients are on medications like finasteride, they only slow hair loss down, they don't completely stop it for good. So we always expect, in fact we assume, that our patients are going to lose more hair.
Always,
right?
always. If you move forward with that assumption, even if they don't, you never put a patient in a bad situation. If you imagine you're going to lose all your hair front to back and I only have what's available here to fix it, and you sort of proceed with that in mind with regard to your harvesting type, how many grafts you're using, where you're starting the frontal hairline, you'll never put someone in a position where 10 years down the road they'll be upset because the hairline was super low and inappropriate, they're out of grafts, things like that. So yes, you should always assume it's progressive, and I think it's safe to hedge your bet. So this is a gentleman, like Dr. Parissis had said, that basically just was coming in for a beefing up, a little bit of tweaking of this frontal area here, and you can see he's maybe like a Norwood 2. I would say, but he also thinned not only in kind of this frontal band region, he also had some thinning in the temple region. And a lot of the times when we hear patients talk about thinning in the temple region, they sort of just mush kind of all this region into one. Sometimes they'll have just classic corner recession, the frontal temporal corners, they'll call that temple region. Other times they still have good temple points, but they've thinned here in this sort of vertical portion that we call the anterior aspect of the parietal hump of this part here of the scalp. This gentleman had sort of a combination of all of it. He had that classic frontotemporal corner recession, the corners that push back. And then he also had some sort of weakening of not only the temporal point, but also this sort of vertical portion here of the temporal point. And when, or the parietal hump, excuse me. And when temples are being rebuilt, there's always sort of different ways you can go with it. You can focus a lot on the temple point. You could focus on the temple point and the parietal area. You can sort of try to merge them into one a little bit, which I think is kind of somewhat what was done here, is that we not only redesigned the temple point, you also sort of integrated it very nicely into the corner here, the parietal hump, the frontal temporal corner. So it all kind of is one nice little design there, and patients really like that. This creates an appropriate look because it still does have some recession. It's not like that you took the temple point up to here or something ridiculous, but it's also a very rejuvenated, I don't want to say juvenile, but a nice rejuvenated look, and it'll be a strong look. So that was kind of the case there, is beefing up that hairline, doing a little bit of tweaking in the corners. And I think you did what, about 2,000 grafts or so?
Yeah.
And so we'll jump into this here. So when was this picture taken?
So this was when the patient came back to get the staples removed.
Mm-hmm.
So a perfect example of how, after a hair transplant, how we may look after just 10 days. So it looks like a buzz cut, if you ask me. Obviously the native hair behind, you can tell, is slightly different in character. That's why it's darker, sort of in these regions here.
It also looks like he may have done an at-home buzz job there, so it's not.
I think so. It's not the most even. It's not the most even.
Probably better than I could do, so I won't laugh. But yeah.
And you can also, I just want to highlight because we were talking about the temple points there. The direction of the hair is super important with temples. And again, to add to what you said as well, Dr. Bloxham, it is important to maintain a bit of a sharpness to this area, because it maintains a masculine look.
Yes.
And not to assume that someone wants a more masculine look or a more feminine look based on their gender, but just to mimic nature, the hairline tends to be sharper and a little bit sort of pointed with men.
Yeah, and something that you brought up a few good points there I want to touch on. So as far as the shape in that corner goes, you're 110% correct that you need to mimic nature here. What I tell patients, a lot of times I'll draw, they'll come in and they'll say, I want to I want to fix the corner and the hairline, and when there's just sort of pantomiming what they want to do, they'll do something like this, which is that more feminine shape. And then I will draw on something that what I call is anatomically correct, where the temple point goes out here, and then it goes up into that anterior portion of the parietal hump. And sometimes I'll show that to them and they'll say, I don't know, mine I think went more like this. And I'll tell them, look, if you shaved your head down, it would actually look like that. If a guy that had a really good definition in the corners and a good temple point shaved his head down, this is what it would look like. It looks, when it's grown out, like it all just kind of curves down into one, but it doesn't. If you were to design something that was all curved down like that, it wouldn't look appropriate. It would look odd. If you were to design something like this, it's anatomically correct, it's correct by nature. Number one, it's going to look good even shaved down like that, because that is how it's supposed to look. Number two, once it's all grown out, it has that curved down look. So that is the right way to do it. I'm not a big fan of that real purposeful curvature down there in the corners. Like I said, I do it sometimes. Sometimes it's appropriate. Sometimes you can sort of tweak it a little bit and get away with it. But it is less of a pattern we see in nature. So that's something to consider if you're having a transplant is, shave is going to look different than long, and you do want to build something that mimics, nature as much as you can. The other point you mentioned, which is just so crucial, is the temple point when it comes to the direction of the hairs, the type of hairs you're supposed to use. So very important. There are a lot of places out there that don't have a lot of experience doing temple points. Having said that, it doesn't stop them from doing temple points. In my opinion, one of the most important things is the technicians when it comes to the temple points, or whomever is placing the grafts, because it's really difficult to place in temples. And the reason why is because not only is it a region that has very thin skin, those angles on those hairs are supposed to be very acute. It's almost like when you're making the incisions, you're almost like running the blade, like across the skin like that, instead of actually like penetrating it, almost like running it across. So what a lot of places will do in order to make it easier to get those grafts in is they'll make the slits, instead of like this, they'll make them very like perpendicular, and that does not look good. In nature, as you mentioned, those hairs lay very flat. They also are going down and back like towards the ears. So if you go to a place where they just want to knock those out and make sure that they can be placed, oftentimes they don't respect the direction, the angle, and temple points that aren't done properly look really bad. It looks odd when you have hair that's like standing straight out on the side there. So you have to make sure you go to a clinic that does it, and watch a few videos on who is and who is not a good candidate for temple points, because some hair types just won't lend themselves well to it. Simply because these hairs naturally are the softest, kind of finest hairs in the whole scalp, and the hairs that we take from the donor, whether you're doing it FUE or FUT, tend to be the strongest, hardiest, thickest, most resilient hairs. So you can't be a guy that has super duper naturally coarse, thick, strong hair and do temple points sometimes, because it's just going to stand out regardless of how properly it's done. Last point I'll mention here before we jump into the results: excellent job cleaning. cleaning. Cleaning is such an important thing after a hair transplant. I firmly believe it can affect the results, and I firmly believe that if you clean, you're at the very least setting yourself up for a good result. And this patient did an excellent job. It's supposed to look like a buzz cut. This is correct. If at any point, always follow your specific clinic's post-op instructions, obviously, but in my office, and I think what you would tell your patients is, this is how it's supposed to look. If it starts to look really cracked, scabby, bad during those kind of crucial post-op days, you need to wash it harder. When I have patients that come in for follow-ups or staple removal, this is what I want to see. So good job on that there. Okay, so when did we next see this patient back? How long is this after surgery, the results here?
Saw this patient just over a year
Okay.
after surgery, so you can see.
Let's jump into
Actually,
that.
excuse me, it was 6 months after
I was going to say,
surgery.
I
6
thought it
months.
was only 6 months.
Yeah, it's only 6 months.
Yeah, okay. So 6-month images here, let's jump into those.
There
Boom,
it is.
gorgeous. Yeah, love, a couple things that I think are relevant here. So with his hairline, not only was the density beefed up, very nice breakup that you did here. When you've got a coarser hair type, when you have maybe a bit more of a contrast between the hair tone and the skin tone, I personally like some of those kind of bigger, wavier breaks opposed to a lot of the very small, jagged breaks, and maybe a little bit less irregularity in general, which is great. You can also see here how nicely his face is framed now, not only because this was flattened out a little bit, but because these temple points were done properly. A lot of the times when we're reframing a face, not only do you want to reframe it in this direction, you want to reframe it in this direction. Something patients will complain about when they lose the temples is that the forehead looks broad and wide. Some people it looks okay on. A lot of people have those broader, wider, kind of flatter foreheads to begin with, but some people it just really changes the dynamics of their face. And bringing it in, not only bringing it back this way, but bringing it in that way can make a huge difference. So excellent there.
Yeah, I just want to add as well, you can see the clinics that don't do those temple points, a lot of their results have that kind of very broad forehead look.
Or that's when you'll see a lot of those really kind of odd curve down in the corners to try to compensate for that, because it closes them off a little bit, and that's when it can look a little, in my opinion, a little off. So
it does.
There's a great shot of that. I love oblique shots, are probably my favorite in all of hair transplant, because you can see how much it changes kind of the front and the profile. You can sort of get the look of the whole thing. But I love that. That temple point looks fantastic. That's not the easiest hair type to do a temple point with, but bravo, it looks really, really good there.
One thing with the temple as well as the temple points is we used only singles. That's super important. It's mainly singles.
And the start there, and that frontal.
Yeah, at the start.
line,
Yeah. Just to kind of create that nice flush.
Yep.
It is part of the hairline at the end of the day.
It is. People forget that it's you have a frontal hairline and you also have a temporal hairline. And if you were to get out the trichoscope and look at these hairs here, they're singles just like these are singles. So you have to do singles in the start of the temple, and that not only includes any part that's facing the face. So here that has to be done with singles. And again, just like there are little tricks and tips for doing this hairline, there are also little details and things that we can do in the temporal hairline to make it look better. And I think this was done very, very well. And you can see nice density there. That's great even at 6 months, pulling it back like that too. That looks fantastic.
Yeah, 6 months is just 50% of the overall result we usually tell patients. So this guy's got even more time, more density to grow, more time to grow. So super excited to see what he's going to look like after 12 months. And just to again tie back to the title of the video, this guy had a hairline beef up. Before, his hairline wasn't that bad. Most people would be quite happy. Maybe a lot of people wouldn't even notice that their hairline has changed to the degree that this gentleman had experienced. So, but look at that after shot. You can't deny that that's a Hollywood hairline. As you said in your previous videos. It just does look great. So, and the fact that that frontal hairline, those hairs, those follicles, contribute to the overall volume in the front half of the head as well, don't they? They really kind of, you know, they change the whole shape of
Yep.
the head almost.
Yep, that's always been a big benefit of transplants, and I tell patients this a lot, is it's surprising how much working in one area can change the appearance of the entirety, like you mentioned, or even another
That's my
area.
point. Yeah.
You know, you can have weakness in the mid-scalp, and if you do a frontal band, you know, you'll see benefit there, even though we didn't put grafts into their areas. The way hair just kind of amorphically falls together, the way that your eyes sort of catch the hair at different angles and stuff, it's surprising how much a little bit like that can kind of change everything. So I agree with you there. The last thing we get into here is the patient's FUT scar. So this was an FUT procedure, so I think it's fair to show the FUT scar. Now, I'll let you talk a little bit about this, but you know, different people heal differently with FUT, with all, you know, procedures. So skin just heals differently. Things like age, things like ethnicity, you know, things like if you have a history of allergies, if you have tightness in the skin, all of that can play a very important role when it comes to scar healing. This is a gentleman whom, for a number of reasons, I wouldn't necessarily tell him he was going to have a perfect pencil line scar. I would say, I think we can get you a reasonable scar. You know, I tell people our average scar is anywhere between that pencil line, if you're just that perfect, all the stars align healer, to maybe a bit of like a marker line, like maybe, you know, 3 millimeters or so of stretch if you're a little bit of a natural stretcher. And anything within that, you know, is considered normal, can be hidden even with short hair. And I would say that that's probably where this gentleman is. Now, this is 6 months. 6 months is still very early in what we call the remodeling phase. But his scar is good, but I would say it's probably on the upper end of, you know, what we consider normal. Yeah. Which, again, that's a reality of surgery. You know, I never try, hopefully I don't, but I never try to sugarcoat that. I always try to be pretty honest with patients about the scars and tell them that it's going to be somewhere, should be somewhere in that range. Maybe it'll be better. You know, maybe I've had guys, especially some older, like Caucasian gentlemen, where you literally, there's like no scar. It's unbelievable. Yeah. And I've also had people where, you know, my good friend Dr. Lindsay from Virginia, who's a facial plastic surgeon, is very good about admitting this. You every, you know, couple, maybe 100 cases you do, you get, you know, 2 or so that just don't heal as well. You know, you get guys that just, for whatever reason, they naturally heal with that wider scar. You know, maybe a 4 or 5 millimeter scar. Always things you can do about it. The final scar is rarely the final scar, is what I tell patients. Always things we can do. But this gentleman, you know, this is about what I would have anticipated for his scar. A good scar, but sort of on the upper, you know, limit of what we consider a normal scar.
Sure. Another thing I've noticed as well amongst patients is one patient who had a great scar, another patient who maybe didn't have as good of a scar, maybe a wider scar. I've noticed that you know, the patient with the wider scar might think, or understandably believe, that the closure technique was different between the two patients. But yeah, you know, we really don't do anything different between patients. At times, if a patient is more difficult to close, if that wound is more difficult to close, we might put some deep sutures in there. But in general, you know, we check the closure very, very thoroughly after every patient, and we are almost 100% satisfied with closure and, you know, with how the wound looks post-operatively.
Yeah, typically
after
looks great.
every patient. Yeah. So it really, you know, not to blame the patient, but it is mostly down to your physiology, how your scar is going to look. It is,
and again, you're nailing on all the right points here. And I'll bring up Dr. Lindsay again, because he just has this great kind of blunt way of putting things. That's what he says. He goes, I sew up all these guys. We use staples, or I typically use staples. He likes to suture, and he says that, he goes, I sew up all the heads the same. You know, some of them heal this way, some of them heal that way. But it's such a good way of putting it, you know. And it does kind of make you step back and think, like, of course we close all these guys up the same. You know, you weren't in a better mood one day and a worse mood the other day. You know, it wasn't like you're like, I don't like this guy, I'm not going to close him up the same way. You know, every single person you give the same, you know, same approach, same protocol, same staff, you know, same consideration, same everything. So we put 110% into closing it. We tell you exactly what to do in that post-op period, but after that, you know, it is physiology, and that applies to everything in the body. It applies to growth, it applies to healing, you know, so that is an important reality of surgery. You know, I know in these videos we like to talk a lot about the fun stuff, kind of the tramp stuff, surgery, but it's a reality of it. You know, is that people heal differently, people grow differently, and I think the best thing we can do is kind of do our best to give people honest, you know, information, and they can, take that and use it in their consideration of when they're deciding to do a procedure. But I think this, like I said, kind of circling back, I do think this is a good scar, but I think it's probably on the upper limit of what I tell patients kind of to expect, and this is what I would have expected in a gentleman of kind of his characteristics. So
yeah, I would agree. All right, guys, so that's it for today. I hope this helps you understand a bit more about hairline beef-ups, what's involved in them, and hopefully that helps you make a decision about whether they might be for you. If you are interested in a video consultation or an in-person consultation, do reach out to me at drparissis@gmail.com, or of course if you are in the US, reach out to Dr. Bloxham over here. So thank you guys for watching, and see you in the next one.